Welcome back. With me now is Dr. Marina Del Rios, and she is an emergency medicine physician. And we're going to talk a little bit about CPR today, but we're going to go kind of from a different angle, and that is from that of the bystander. And so let's talk, doctor, a little bit about why somebody might be hesitant to jump in if they see somebody in distress and how we might overcome that.
Well, I think there's certainly a number of barriers. One, most commonly, people may just fear harming someone, right? If you are not confident in your CPR skills, you may worry about doing more harm than good. There's also fear of maybe legal consequences. Am I going to get in trouble for, jumping in with someone that I don't know to start doing chest compressions? Am I going to be held liable if something wrong happens to them? And then obviously there's also, just this hesitation on knowledge. Even if you've learned how to do CPR in the past, if this is not something that you do every day, again, that fear of doing it incorrectly is something that often makes people take pause before they decide to act. But I think the important thing to know is that doing any CPR, and especially doing hands-only CPR, which we know is as effective as conventional CPR, which is CPR with rescue breathing. So hands-only alone is as effective, and it's better than not doing anything. You will give people a better chance of survival, 2 to 3 times a better chance of survival by doing hands-only CPR than by standing by and not doing anything.
That's a big number, so that really is very, very helpful. And let's talk a little bit about the hands-only. I know, as you said, in the past it was the breathing and hands. Now they're more towards just the hands-only. How often should somebody kind of go back through CPR training so they're up to date? And tell us a little bit about what hands-only means.
Well, hands-only really is just that. Hands-only is you're only going to use your hands. You're not going to worry about rescue breathing. And training is very easy these days. It really can be as easy as watching a video, as is the one that you're seeing on TV. There are a number of websites that you can go to learn about CPR. I would just caution people about what websites you're going to, because unfortunately there's still a lot of older videos that may not have the correct information. But for sure, a reputable source is always the American Heart Association. And we actually have right now a campaign that we just launched in August. It's called the Heroes Saving Hearts campaign, where we just launched this website. It's heart.org /CPR Heroes, where we have available there video resources on how to do CPR, what to do in the setting of a cardiac arrest, how to activate the emergency medical response system, and so on. So it's in your hands to save a life, and it's easier than ever with, again, the American Heart website, heart.org /CPR Heroes. And if you want to learn more, I would encourage people to seek out opportunities in your community. A lot of fire departments offer free CPR lessons. A lot of public libraries are doing this. Some local hospitals offer this as a service to the community. So don't be afraid. It's in your hands to save a life.
Well, doctor, thank you so much for being here with us to kind of remind us that it really does make a difference if you jump in and give somebody a hand, in this case, hands-only CPR. And thank you so much for reminding us of that and giving us those resources. We appreciate it.
Well, thanks for having me.
We'll be back in just a moment with this week's Weekend Warm-Up. Don't go away.